I leave about 7 inches. Like it? The base plate on C.
Okay.
The stem that goes into the arm bone is now much smaller than it used to be. It used to be long down to about this area. So it goes into the arm bone and it used to come down much further into the arm. And these smaller stems take away a lot less bone, a lot less invasive. They have great fixation as there's a rough coating on the stem where the bone actually grows into that area. And it gives a very solid fixation, and it's much smaller, less invasive. And that's part of the minimally invasive techniques that we use. We're done. Great range of motion. No more bone-on-bone pain. Okay, so we make a three-dimensional model of the entire scapula. This is the whole scapula. That's based off a CT scan. That's a three-dimensional CT scan. And what the CT scan does is configures the socket side, what's called the glenoid. This is the socket of the shoulder, this area here. And what we want to do is recreate the patient's anatomy. So what we want to do is put our components in an exact central location, which is done off the CT scan. What this model does is then gives us a guide. This is the guide we'll use during the actual surgical procedure, which fits precisely onto the actual glenoid or the socket side of the shoulder. And then the pin is placed into the hole, and the pin is placed centrally directly into the patient's anatomy, so we know our exact location. We have the exact location of the center pin, and that will help place our components into the socket and give us an exact location based on each patient's specific anatomy based off the three-dimensional CT scan. And we use now a much shorter stem, what's called a micro stem. And the micro stem removes a lot less bone, it's a lot less invasive, and it sits into the patient's arm with a lot less bone removal. So there's less pain and quicker recovery post-operatively.